Hey Robert, welcome to the clinic. My name's Brendan and I'm the exercise physiologist assisting you today. Before we start, everything we discuss in this meeting will remain confidential and only accessed by myself and third parties with your explicit permission. This meeting is also being recorded for training and quality assessment purposes with the intent of review. If you have any concerns or wish to refrain from being recorded, please let me know.
Yeah, that's no problem.
Yeah, fantastic. If that's not an issue and I have your consent, I'm happy to proceed with the appointment.
I'm happy to proceed with the appointment.
Fantastic. So what brings you in today, Robert?
Ever since I was diagnosed with cancer again last year, I've noticed a decline in my ability to do day-to-day stuff, and the doctor said an exercise plan could help maintain it.
Well, look, sorry to hear about that first off, Robert. How would you say your ability has declined?
Well, I'm not able to walk for as much as I could this time last year, and I get tired a lot faster, and I'm not as strong anymore.
I see, and I can see how that would impact your life quite a bit. So, if you're okay with sharing it here, did you mind just talking to me about your past cancer experience?
Well, in 2015, I was diagnosed with stage 3 prostate cancer, and after surgery and some radiation therapy, everything looked pretty good.
And so, I'm assuming the cancer came back after that recently.
Yeah, exactly. Cancer seemed to be going away, but after I came back from my trip to Europe last year, I checked in with my doctor about some weight loss, back pain, and bowel issues, and he ran a few tests that showed that the cancer had come back, and I was then diagnosed with hormone-resistant metastatic prostate cancer.
Yeah, look, I'm sorry to hear about that, Robert. Having prostate cancer return after all those treatments must be incredibly tough.
It was tough. It really put a stop to the old retirement plan.
Yeah, and again, really sorry to hear about that. But if it's okay, do you mind just running me through your current cancer treatments?
Yep, that's no problem at all. First, the oncologist got me on hormone therapy. I've been getting goslorin injections every 3 months since about May last year. I was then put on chemotherapy with Doctor every 3 weeks for 6 sessions in June.
Okay, and how did the chemotherapy go?
It was challenging, to be honest. I was in the hospital a couple of times with low iron and I had severe nausea and fatigue. However, since the chemo, I've gotten much better and the doctor says the treatment seems to have worked.
Okay, well, look, sorry to hear that the chemo had such an impact on you, though. It's pretty good to hear that the treatment has been helping. Have you noticed since your hormone therapy, how that's affected you since your initial injection?
Well, it started fine, but after about a month, I noticed I was getting a lot more tired whilst gardening and I lost a lot of strength and fitness. It's gotten progressively worse throughout the therapy, and I've noticed I've been feeling pretty depressed some days, which the doctor said might happen.
Okay, well, thanks for sharing that, Robert. I know some of the symptoms of hormone therapy can be pretty personal, so I really appreciate you sharing that. And I'd like to say as well, I'm really happy you've come in today. A lot of the symptoms you've been experiencing with hormone therapy, from what I can tell as exercise physiologists, is what we can help with. And it's a large part of our role to assist with improving your day-to-day life and your everything during those treatments there.
Okay, but how can it help me specifically?
Well, exercise not only helps you maintain that strength and physical function that you've been noticing a loss in, but it also leads to improvements so you can get back to your retirement easier. There's also a large evidence that says it will assist combating that depression and prevent other conditions from getting worse. There's also evidence that suggests that it could even make the hormone therapy more effective too.
Okay, that's a lot. Thanks for that.
Yeah, that's no problem at all. But just to finish up here with the cancer-related questions, how's your cancer condition looking after your last treatment?
My PSA score indicates that I'm not cancer free yet, but the results look promising. However, my last CT showed that the cancer has spread to my hip and pelvis.
Okay, and so other than the hormone therapy, did you have any other treatments planned?
Not at this stage, no. With my severe reaction to the last round of chemo, I am sticking with the goslorin for now.
Okay, great. Thanks for sharing that, Robert. I'd just like to now review some general health questions, just to get a better overall picture, just predominantly stuff about information about yourself and your other conditions.
Sure.
Fantastic. So first off, I just need your age, height, and weight.
I'm 78, 102 centimeters tall, and I'm 88 kilograms.
Okay, and did you drink or smoke?
No.
No. And how can you tell me about your current diet?
My wife cooks most nights, so I don't have much choice. Usually plenty of veggies, chicken or steak, or some pasta and rice with that. We do have takeout once a week, though, typically.
Okay, and what would you say your typical amount of exercise looks like during a week?
Not much with how much the fatigue and weakness have affected me. I'll do some gardening once a month, but not much otherwise.
Okay, and how much were you exercising before your current treatment?
I was definitely more active. I was doing a lot of traveling, so I walked more and I had a lot more energy to help around the house.
Okay, and so other than the treatment symptoms, is there anything preventing you from exercising now? This could include time or even access to facilities.
No, I have plenty of time in retirement and I've got a park across the road.
Okay, and what experience do you have with exercise previously?
I was in the gym a bit when I was younger, but most of that stopped with the cancer diagnosis in 2015.
Okay, and is there any particular time you'd like to exercise?
I like to sleep in and I get tired by the arvos, so around lunch would be best.
Okay, and did you have any preferences for what type?
I just stick to what I know. So gym work and walking sounds good.
Fantastic. Okay, and what are the main things you'd like to see come from the program?
I think the main one is just being able to pick up my grandkids again.
Okay, that's for sure something we can work on, and I'm assuming getting back to gardening would be one as well.
Yeah, if I could return to gardening twice a week again, that would be amazing.
Yeah, of course. And is there anything else?
I'd like to be able to help my wife with the housework again. Getting up and cleaning or being able to help her with the shopping would make life easier for her and me.
Okay, sounds good. So to ensure I've got the full picture, just going to ask some more general health questions. Is that okay?
Yep.
Yeah, fantastic. So have you ever been told that you have high blood pressure, high cholesterol, recently had a stroke, or type 2 diabetes?
I was diagnosed with type 2 diabetes in 2000, high blood pressure in 2004, and high cholesterol in 2008.
Okay, and what interventions have you taken to assist with these conditions?
In 2010, I had an angioplasty. I'm taking Lipitor, Asterix, Avapro, and Diabex.
Okay, and have you had any trouble managing these conditions recently?
Not at all. These were diagnosed quite a while ago, and I've got a pretty good hold of them now.
Okay, that's good to hear. And to finish up here, are there any other medications you'd like me to know of?
No medications, but I do get occasional back and hip pain. Yeah, but that's about everything.
Fantastic. So thanks heaps for sharing that today, Robert. Really it means a lot that you're getting in here and really trying to put in the effort there. That's just about everything. I've got a pretty good overall picture of everything and actually have some thoughts on your situation. Would you like me to share those with you today?
Yeah, of course.
Yeah, fantastic. Alrighty. So, though your cancer seems to be getting better, I believe you're still in the treatment stage of cancer management. This means you're likely to continue treatment and may even see some more down the line, especially with the spread to the bone. As such, with the hormone therapy you're undergoing, the steady decline you've noticed with your strength and function will likely continue or worsen. Additionally, with your age, weight, cancer treatment, and other conditions, you're at pretty high risk for osteoporosis and obesity. However, much of this can be assisted with exercise, and we can even reduce a lot of those risks. Many of the goals you've set for yourself are achievable, and with the appropriate care, I'm confident there's a lot we can do for you to improve your quality of life and get you back to enjoying your retirement.
I see. Thanks for that.
Yeah, no worries at all. And once again, thanks a lot for coming in. It is truly the first step here, and we can really do a lot here. Unless there's anything else you'd like me to mention, I'd love to see you in a couple of weeks here, and we can get started on that exercise program.
Sounds good to me.
Fantastic. We'll see you then.